bone, it's an interesting one in regards to dental implants. So there are various factors when we talk about the bone, and I think your question, which I've probably edited out, was sort of relating to when the implant's placed and what happens over time. When we sort of look at the bone, I'm going to start off at the beginning. We will either sort of take a CBCT, not always, sometimes we'll take a small radiograph, and that'll give us an idea of, let's say, the quantity of the bone or the bone volume. So we can determine whether there's enough bone to surround the implant. And this is, we're looking at macro features here. So we're looking at the amount of bone that we have. And if there's not enough bone to get an implant in there that is, let's going to say, stable, this is called primary stability, then we may consider adding a product back. And there are various products that we use. It's an augmentation procedure, and we can use the patient's own bone. We can use donated bone from another human. We can use animal-derived bone, or we can use synthetic bone, and they've all got their pros and their cons in how they work. And there's a discussion as to which one we use, which one the patient's comfortable with, and which one is going to achieve hopefully the best results for the situation that we're dealing with. So once we've determined that we have enough bone or enough bone volume, then we can place our implant. And then there's a kind of what we call the bone quality. So some patients may have extremely hard bone, really solid and dense bone. So this may have very little blood supply, and therefore, the implant preparation may be a little bit more difficult, and we just need to consider that when we are preparing for the implant, that we don't overheat that bone too much, and that there is enough blood supply to get some healing. So we do need some blood getting there. And then on the other end of the spectrum, we've got the really soft bone, very, very soft, like polystyrene. And placing an implant in that and getting stability can sometimes be a little bit difficult. So we may determine to leave the implant in that type of bone for a longer period of time, more than we would do if we had, for instance, type 2 or type 3 bone, let's say, call it medium density bone. So once we've placed our implant, that bone that sits around that implant is not the same bone that is going to be there in another 7, 10, 15 years. So bone, it's a living system, and the bone cells that are on that implant surface are going to be working away consistently, and therefore the bone that your implant is placed into on day one is very different bone 7 years later. So we need to understand this when we're talking about the success rates of implants and whether implants will last a lifetime or not, because there are various factors that can influence that bone metabolism and how these bone cells work. And these can be such things as periodontal disease, smoking, diabetes, certain medications that may be introduced. So therefore, if a patient's sort of health deteriorates, then there's a possibility that the bone around that implant could also deteriorate. So we need to have a look at these risk factors, and we need to have this conversation with everyone that we are proposing to place implants in, so that they understand that this is not something that is a lifetime guarantee, and that maintenance is going to be required, and that there are factors that can influence the success rate of that implant even once it's integrated and has been successfully restored. Therefore, there are recall periods, as we do with teeth, where we check these implants out, and that may be risk-based. So for somebody that has some risk factors, such as diabetes or periodontal disease, we may be asking these particular patients to return for checks a little bit more frequently, let's say every 3 months. And then somebody that has lesser risk factors or no risk factors, we may be talking about every 6 months to have their implants checked. And the way the implants are checked is exactly the same as teeth, a little bit gentler probing because the tissues that heal around the implants are a little bit more fragile than those compared to teeth. And we're looking at any signs of inflammation, we're looking at any signs of bleeding. We may determine that an x-ray may be required so we can have a look at the bone levels, and then we can compare those bone levels to our baseline levels from an x-ray that would have been taken once the implant had been restored, and maybe after a couple of weeks or a month after restoration, because there are some slight bone changes once you put a crown on an implant and put that implant into function. We do see some modification of the bone. So taking an x-ray as soon as the crown has been placed may give us a slightly inaccurate reading if we take an x-ray a couple of years later and then determine there's some bone loss that actually may have occurred once the implant had been in function for a month or so. So we often sort of take that repeat radiograph maybe 2 months, 3 months after the crown has been fitted and has been used by the patient, or bridge, or whatever situation we've put our patients into. So I hope it gives that insight into sort of what's happening with the bone, and implants aren't, a lifetime guarantee, although they are a very, very long-term successful solution for missing teeth.